Climate change, air pollution, and human health are not separate crises. They are deeply connected. Across India, millions live with the everyday consequences of polluted air. From respiratory ailment to heart conditions, the impact is felt quietly but relentlessly. This film takes you to Indore, a city in the heart of India. One doctor is doing more than advocating for change. By embracing clean, non-conventional energy, he is proving that protecting health begins long before a patient enters the clinic.
When we are using these traditional fossil fuels, then we create a lot of pollution. And this pollution is always disastrous to health. It is dangerous to health. We have been talking continuously what problems it can create for us. It creates respiratory issues. It creates issues to all parts of body, including a lot of cancers of different parts of body. And that's why it is right time to think upon what should be the sustainable source of energy. In fact, we have been thinking with our group of doctors, that is Doctors for Clean Air and Lung Care Foundation. And we are thinking that is it the air pollution which is really hitting our lungs? Are they getting black? Are we getting COPD, chronic bronchitis and other diseases? And that's why we all have started thinking of different types of energy. In fact, when we talk about energy, it should be a sustainable energy, it should be eco-friendly, and it should not harm our Mother Earth. And that is really, we understand that is the solar energy, which we can use it very liberally and very frequently.
In this city, over 3/4 of working women report health problems linked to vehicular pollution, and nearly half struggle with persistent weakness.
So we get patients with chronic bronchitis. Some cancers are also increasing. Some psychiatric disorders are there. And apart from this, whatever the routine things like hitting heart in the form of heart attacks, high blood pressure, and other disorders of body, they can also be there because of this air pollution.
Around the world, the evidence tells the same story. Polluted air threatens life before it even begins. Broader toll is staggering. Millions of premature deaths each year, driven by our dependence on coal, oil, and gas. Fossil fuels harm at every stage of their life cycle, from extraction and refining to transport and waste, leaving an imprint on every breath we take. The science is clear. The path forward is a just transition, moving away from fossil fuels while protecting livelihoods and putting health at the heart of climate action.
We have been using the solar water system and solar electrical system for last 3 years since I have started building my clinic. And you will be surprised to know that I have initially put some money into it, but now I am getting from 13, 15 units to 20 units per day out of it. And that's a great thing to us. And I've been using this electricity for my lifts, my equipments, my light sources and other things. So I've been supporting the carbon footprint system and the ecosystem. And this is the way you can see that what type of energy and how much energy we are generating daily. So this pink color building is my residence. And you can see there is a water system which is there, and nearby it there is electrical system. So it has been installed for about 3 years back, and the water system is there for us with us for last 15 years. So we have been using hot water and electricity also through the solar system, and that's how we are supporting at both the ends, at my clinic as well as my residence, our earth and to the ecosystem.
Dr. Bhargava's journey is not an isolated effort. It is a reflection of what DFCA envisions, doctors across India leading by example, championing clean air as a public health priority, and inspiring action in their communities.
I've always been reading, learning, and looking to the sun. That this is available with me at least 12 hours, 8 hours, 10 hours a day. Why we are not utilizing it? But when the different types of things are hitting our Mother Earth, then I thought that I should also choose the way the world is moving forward. So I started using solar energy at my clinic as well as at my residence. I'm using solar water heaters also. When we think of Earth, our ecosystem, our nature, we should always think of sustainable energy. We should choose a form of energy which is easily available, like the solar energy. We should avoid using energy where it can cause air pollution and other problems to our next generation. So we should try to choose and shift immediately, as quickly as possible, to the solar energy.
When doctors like Dr. Bhargav choose clean energy, they protect both their patients and the planet. Through DFCA, this movement is growing. Doctor by doctor, city by city, Dr. Bhargav's message is simple. Clean air is not a privilege. It is a prescription for life.